Most men over 50 have made a quiet, private decision about masturbation, and they've never once questioned whether that decision is backed by science. Some stopped entirely, convinced it was shameful, immature, or simply something they'd outgrown. Others continued, but carried a low-level guilt they've never quite shaken. A voice in the back of their mind that whispers, "Maybe this isn't good for me." What almost nobody told either group, what I'm going to show you today, is that the research has a very different story to tell, and it may completely change how you think about your own body. Here's what we're going to cover today, and I want you to stay with me through all of it, because each piece builds on the last. First, we're going to look at the physiology, what masturbation actually does inside your body, to your prostate, to your erectile tissue, to your cardiovascular system, and why, for men over 50 specifically, the science is far more protective than most people realize. Second, we're going to talk about the real dangers, because yes, there are ways masturbation can genuinely work against your sexual health. But they are specific, they are behavioral, and they are entirely avoidable. Once you know what they are, you can sidestep them completely. Third, we're going to explore the neurochemical picture, what happens in your brain and your hormonal system during and after orgasm, and why the shame most men carry about this topic does far more damage than the act itself ever could. And finally, I'm going to give you a simple three-part framework: frequency, technique, and intention, that you can apply immediately based entirely on clinical evidence. By the end of this video, you will have something most men over 50 have never had: a genuinely informed, shame-free, science-backed understanding of this part of your sexual health. And that understanding is going to serve you. I'm Dr. Janice Powell. I'm a certified men's sex therapist with over a decade of clinical experience. And this channel exists for one reason: to give men over 50 the honest, research-backed conversations about sexual health that the rest of the world seems determined to avoid. If this is your first time here, welcome. And if this kind of content matters to you, please hit subscribe right now. Every week, I cover the topics your doctor doesn't have time for, your friends won't bring up, and the internet gets badly wrong. You deserve better than that. This channel is where better lives. Let's get into it. What masturbation actually does to your body. Let's start where the conversation almost never starts, with the biology. Because here's something I want you to understand before anything else. Your penis is not just a reproductive organ. It is a vascular organ. Its health, its long-term function, depends on regular blood flow, regular engorgement, regular use. And this is where one of the most important principles in men's sexual medicine comes in. Urologists and sex therapists call it the use it or lose it principle. And while it might sound like a motivational slogan, it is grounded in serious tissue physiology. Here's what happens at a cellular level. The erectile tissue inside your penis, the corpora cavernosa, is made up of smooth muscle cells surrounded by a network of blood vessels. When you become aroused, those smooth muscle cells relax, blood floods in, and you achieve an erection. That process oxygenates the tissue. It keeps those smooth muscle cells healthy and elastic. But when erections don't happen regularly, whether due to inactivity, avoidance, or simply not making space for sexual expression, something shifts. The smooth muscle tissue begins to be gradually replaced by collagen fibers. This process is called fibrosis. And fibrotic tissue doesn't stretch. It doesn't engorge. It doesn't respond to arousal the way healthy tissue does. In plain language, men who go long periods without erections, for any reason, are at significantly higher risk of developing erectile dysfunction that becomes increasingly difficult to reverse. Now, where does masturbation fit into this? For men over 50, particularly men who are not in an active sexual relationship, or whose partners have different levels of desire, or who are recovering from prostate surgery, or who are simply going through a dry spell, masturbation is one of the primary ways the body maintains penile vascular health. It is not indulgence. In those contexts, it is closer to maintenance. But the research goes further than erectile tissue. Let's talk about the prostate. In 2016, researchers at Harvard Medical School published a landmark study in the European Urology Journal. They followed nearly 32,000 men over 18 years and looked at the relationship between ejaculation frequency and prostate cancer risk. What they found was striking. Men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated just 4 to 7 times per month. 33% from ejaculation frequency alone. The proposed mechanism is what researchers call the prostatic stagnation hypothesis. The prostate gland continuously produces fluid. If that fluid, along with any potentially carcinogenic substances it may contain, sits in the ducts without being regularly cleared, the risk of cellular damage increases over time. Regular ejaculation, whether through partnered sex or masturbation, acts as a flushing mechanism. It keeps the glandular environment cleaner. Now, I want to be careful here. This is correlational research, not a prescription. I'm not telling you that masturbating 21 times a month will guarantee you never develop prostate cancer. Biology doesn't work in guarantees, but the direction of the evidence is consistent. It has been replicated in multiple studies, and it points clearly toward regular ejaculation as protective rather than harmful. There's one more physiological dimension I want to cover before we move on, and this one is specific to men in their 50s and 60s. As testosterone levels naturally decline with age, so does spontaneous arousal. In your 20s and 30s, erections happened whether you wanted them to or not. By your 50s, arousal typically requires more deliberate stimulation and mental engagement. This is completely normal. It is not dysfunction. It is physiology. But here's the important implication. Because arousal is less automatic, the cardiovascular workout that comes with sexual activity, the heart rate elevation, the blood pressure fluctuations, the full body physiological engagement, happens less frequently unless you actively make space for it. Masturbation for men in this age group is one of the ways that space gets made. And the cardiovascular and vascular benefits that come with it are real, measurable, and meaningful. So let's recap part 1. Masturbation at a physiological level supports prostate health, maintains erectile tissue integrity, and provides vascular exercise that becomes increasingly important as men age. That is what the science says. Part 2. The real dangers, where it can work against you. Now, I promised you I'd be honest about the risks, and I will be, because there are ways that masturbation can genuinely harm your sexual health. They just aren't the ones most men worry about. The first is something clinicians sometimes call death grip syndrome. It's not a formal medical diagnosis, but it describes a very real phenomenon. When men masturbate with excessive pressure or friction, gripping too tightly, using a stroke that no partnered sexual experience could replicate, they can desensitize the nerve endings in the penis over time. What this means practically is that the kind of stimulation required to reach orgasm escalates. Men find that partnered sex, with its natural variation in pressure and sensation, no longer feels like enough. They need to replicate that specific, high-intensity stimulation pattern to climax, and they can't. Which leads to frustration, avoidance, and, eventually, erectile difficulties in partnered contexts. The fix is straightforward, but it requires patience, a period of reduced stimulation, a change in technique, and time for nerve sensitivity to recalibrate. But the key takeaway is this: technique matters. Not morally, physiologically. The second risk is pornography-induced erectile dysfunction, or PIED. This is a growing area of research and clinical concern. When masturbation becomes consistently paired with high-stimulation visual pornography, particularly the kind that escalates in intensity over time, the brain's dopamine reward system can become conditioned to that specific type of stimulation. The result is a man who can achieve and maintain a strong erection while watching pornography, but struggles significantly with arousal in real-world partnered situations. The brain has essentially been trained to respond to a stimulus that real intimacy cannot provide. Again, this is not a moral judgment, it is neuroscience. The dopamine system responds to novelty and escalation. When one source of stimulation is repeatedly used to drive that system to its limits, the system recalibrates around that source. And real human intimacy, warm, imperfect, embodied, can start to feel underwhelming by comparison. For men over 50, where arousal already requires more deliberate engagement, this pattern can compound existing challenges significantly. The third risk is compulsivity. Masturbation becomes problematic when it begins to disrupt daily functioning, when it interferes with work, relationships, sleep, or other responsibilities. This is not classified as an addiction in the current DSM-5, but it is recognized clinically as hypersexual behavior, and it warrants professional support when it reaches that threshold. Here's the important distinction I want you to hold. Regular masturbation is not compulsive masturbation. Frequency alone does not determine harm. Context, control, and consequence do. Part 3. The neurochemical picture. Your brain, your hormones, and the shame factor. 8:45 to 10:05. Let's talk about what's happening chemically, because this is where the conversation gets particularly important for men over 50. During sexual arousal and orgasm, your brain releases a cascade of neurochemicals. Dopamine surges during arousal. This is the brain's primary reward and motivation chemical, and it is responsible for the drive towards sexual activity. Oxytocin, often called the bonding hormone, rises significantly at orgasm, promoting feelings of relaxation, warmth, and emotional connection. Endorphins flood the system, producing a natural analgesic and mood-elevating effect. And prolactin rises after orgasm, contributing to the feeling of satiation and the refractory period that follows. For men over 50, this neurochemical cocktail carries specific relevance. Oxytocin has been shown to reduce cortisol, the primary stress hormone. Regular orgasm, through any means, is associated with lower baseline stress levels, better sleep quality, reduced anxiety, and improved mood. At an age when cortisol levels can chronically elevate due to work pressure, health concerns, and life transitions, this is not a trivial benefit. There is also the testosterone picture to address, because this is one of the most persistent myths I encounter clinically. Men worry that masturbation depletes testosterone. The research does not support this. One study did find that 7 days of abstinence produced a brief testosterone spike on day 7, but levels returned to baseline quickly, and there is no evidence that regular masturbation causes any long-term suppression of testosterone production whatsoever. And now I want to address the single most damaging element in this entire conversation, and it has nothing to do with frequency, technique, or hormones. It is shame. Study after study in sexual psychology has found that it is not masturbation itself that produces psychological harm. It is the internalized shame and guilt surrounding it that does the damage. Men who engage in regular sexual self-expression but carry deep shame about it show higher rates of anxiety, depression, and sexual dysfunction than men who engage with equivalent frequency but without that shame burden. The behavior is the same. The neurochemical outcome is the same. What differs is the story the man tells himself about what it means. And that story, rooted in cultural messaging, religious conditioning, or simply never having had an honest conversation about it, is where the real harm lives. This is why I do what I do. Not to give men permission. You don't need my permission. But to give men information, so that the decisions they make about their own bodies are grounded in evidence rather than inherited silence. Part 4. The actionable framework. Frequency, technique, and intention. So let's bring this into something practical. Based on the research and on over a decade of clinical work with men in this age group, here is the three-part framework I want you to take away from today. The first element is frequency. There is no universal prescription here, and anyone who tells you otherwise is not being honest with you. But the research suggests that for most men over 50, regular ejaculation, somewhere in the range of a few times per week, is associated with the best outcomes for prostate health and erectile function. That does not mean every man needs to hit a specific number. It means that prolonged, intentional avoidance, weeks or months without any ejaculation, is not neutral. It carries physiological cost. If you are in a relationship, partnered sex absolutely counts. Masturbation is one avenue among several. The body doesn't distinguish. What matters is regularity. The second element is technique. Use a grip and a level of stimulation that approximates real-world sensation, rather than maximizing intensity for its own sake. This is not about reducing pleasure. It is about keeping your neurological response calibrated to the kind of stimulation that partnered intimacy can provide. If you notice that you require very high pressure or a very specific stroke to reach orgasm, that is worth paying attention to. Deliberate recalibration, using a lighter touch, slowing down, allowing sensation to build more gradually, can restore sensitivity over time. Equally, if pornography is a consistent part of your masturbation practice, consider honestly whether it is serving your overall sexual health or whether it has become the primary driver of arousal in a way that is narrowing your responsiveness. That reflection is worth having. Not out of guilt, out of informed self-awareness. The third element is intention. This is perhaps the most clinically underrated aspect of sexual self-care for older men. Approaching masturbation with presence and intention, rather than as a rushed, purely mechanical release, changes the neurochemical experience meaningfully. When you slow down, when you engage your full attention, when you allow the oxytocin and endorphin response to build rather than cutting it short, the psychological benefit is substantially greater. For men over 50, this can also serve a genuinely useful function: body awareness. Regular, attentive engagement with your own arousal and orgasm allows you to notice changes in sensation, in erectile quality, in refractory time, that can be early indicators of vascular or hormonal shifts worth discussing with a physician. Your body communicates. Paying attention gives you information. The maturity advantage. I want to close the content portion of today's video with something I say regularly to my clients, and I mean it completely sincerely. Men over 50 are, in many ways, better positioned to have a healthy relationship with their sexuality than men half their age. Not despite their age, because of it. Here's what I mean. Younger men are often driven by urgency, by performance pressure, by the need to prove something, by an arousal system so insistent it barely leaves room for self-awareness. By 50, most of that urgency has softened. The refractory period is longer, which means there's more natural space between experiences. Arousal requires more engagement, which invites more presence. The performance anxiety that dominated earlier decades has, for many men, simply quieted down. What replaces it, if you allow it to, is something genuinely valuable: embodied, attentive, informed sexual self-awareness. The capacity to be in your body rather than just using it. To notice what actually feels good rather than chasing a familiar script. To treat your sexual health as exactly what it is, an integral part of your overall health, rather than a source of shame or a private secret you carry alone. The men I work with who thrive in this area are not the ones who have the most sex or the most frequent orgasms. They're the ones who have made peace with their sexuality, who understand their bodies, who approach this dimension of their health with the same informed, proactive attention they give to their diet, their cardiovascular fitness, their sleep. That is the maturity advantage. And every man watching this has access to it. Let me give you the integrated picture one more time. Masturbation for men over 50 is not dangerous. The evidence does not support that conclusion. What the evidence supports is this. Regular ejaculation is associated with lower prostate cancer risk, better erectile tissue health, and meaningful neurochemical benefits including stress reduction, mood support, and sleep quality. The genuine risks are specific and avoidable. Excessive stimulation pressure that desensitizes nerve endings, pornography use that reconditions the arousal response, and compulsive patterns that disrupt daily life. None of these are inevitable. All of them are addressable with awareness and, when needed, professional support. The framework that serves you best is frequency, keeping regular without fixating on a number. Technique, keeping stimulation calibrated and intentional. And intention, bringing presence and body awareness to this part of your health rather than treating it as something to get through quickly and forget. And above everything else, release the shame. Not because shame has no function in human life, it does. But because the shame most men carry about masturbation is not protective. It is inherited. It is not based on evidence, and it is doing you no favors. You deserve to understand your own body. You deserve to make informed decisions about your sexual health. And you deserve to do that without the weight of unexamined guilt sitting on top of every private moment. If this video gave you something useful, a new frame, a piece of research you hadn't encountered, or simply the experience of having this conversation in a straightforward, clinical, shame-free way, please like this video. It tells YouTube that this kind of content matters, and it helps other men who need this information find it. If you have a question about anything we covered today, or about a topic you'd like me to address in a future video, leave it in the comments. I read them. Your questions shape what this channel covers next. And if you haven't subscribed yet, now is a good time. This channel is built around one commitment, giving men over 50 the honest, evidence-based, clinically grounded conversations about sexual health that they deserve, and rarely get anywhere else. Thank you for being here. Thank you for taking your health seriously enough to watch a video like this. That matters. I'm Dr. Janice Powell. I'll see you in the next one.